Greetings. My name is Brian Turner. Some like to call me Dr. Turner. I'm currently an assistant professor of psychology at Xavier University of Louisiana. I'm also a licensed clinical psychologist. What that means is I practice the field of psychology. I practice psychotherapy. What I like to think about in terms of the work I do is I help people achieve the results that they want in their lives across a number of things. It could be depression, anxiety, family issues, relationship issues. My role at Xavier coincides with my practice in that I'm really working to ensure that undergrad students, predominantly African American students, are trained and ready and prepared to go to graduate school to do the study of psychology, to move into the field so they can also be solid clinicians who are able to help people in communities of color as well as in any community. It's important for us to discuss the issues of mental health in the Black community because of the taboo. The taboo is that African Americans, people of color, don't historically need mental health care. If we don't talk about it, if we don't actually allow ourselves the space to have these conversations, then people hurt. As African Americans, people of color, we have a history of trauma and experiences that have not been very pretty. And when we don't have professionals in our communities who can address the issues, we continue to experience negatives. Research has found that for persons of color, specifically African Americans, there is a strong relationship between psychological distress and poverty, meaning persons who experience poverty are more likely to experience psychological distress. Now, that's kind of a chicken and egg conversation because if a person is born into a situation where they may not be the best financially, then that means there's going to be some resources that may not be available to them just to start. However, we also find that even when people have resources, if they have a poverty of information, they may also not do well. So what I like to think about is that specifically, if a person doesn't have access, opportunity, information, they're not going to be able to get what they need. Access means I have the actual ability. There's a hospital in my neighborhood. There's people who I can go to that are well aware and well equipped with what I need. Opportunity, I have the opportunity to go. So I'm able to actually make appointments. I'm able to engage people who can assist me. And last, information. And of course, we live in a consumer age. And what I think about is everybody has some way to get on the internet. So everyone should be able to access information about what psychology is, what psychotherapy is, what mental health is, what is wellness, what is healthy. And so I think when people don't have those three things, that's where we see a big connection between poverty because we understand, especially in America, if a person doesn't have enough money to eat, to keep the lights on, they're probably not going to be able to, in the immediate, to think about their mental health care. It becomes vitally important for institutions like Liberty Bank, anchor institutions, and communities of color to not just be here, but to provide access, opportunity, and information for persons who may not have the direct ability to get that. When we have persons like Alden McDonald, when we have persons like LaToya Cantrell, the newly elected mayor, we need those persons to be spokespersons for people being healthy. We have to make sure that we have resources to where people are able to understand just how important it is that we don't just make this about a number. Had serious cuts to mental health services in terms of the Affordable Health Care Act, also known as Obamacare, being cut. But what that means is in communities of color, persons who were getting insurance and were able to pay for mental health services no longer have that opportunity. So not only do we have to just highlight the issue, we have to make sure we have partnerships between community anchor institutions as well as service providers so that they can have some subsidies for their services to do it at low cost, at reduced rates, or even free when necessary. So first and foremost, we have to be honest that there are multiple entities in the city that people can access based upon their needs. You have Metropolitan Human Services District. You have the various hospitals and institutions in the city, as well as, once again, the go-to is if a person has insurance, contact your insurance company and find out who they can help provide services through. Mainly because if you can get insurance and you get service through insurance, it's probably going to be paid for and free. However, there are opportunities to work with different agencies in the city through Goodwill, through Catholic Charities, and other institutions. For me specifically, I'm in private practice, so what that means is I don't work all day, every day in practice. I am able to provide my services, usually at reduced cost, but you have to call me at 504-292-9862. You can also email me at drturner504, that's DRTURNER 504 at gmail.com, as well as just, you can look me up, you can find me. I'm not hiding, I'm out here and I'm available. I love to talk to people about mental health, so a lot of times we can probably have a conversation, and you may not need me as Dr. Turner. It might just be a good conversation, but you can find me by looking me up. You can Google me, or like I said, call me at 504-292-9862.